test, which is almost like something out of science fiction, is now in use by doctors at Fort Hamilton Hospital.
In a story you'll see only on Local 12 News, Liz Bonus shares how it may help predict the future of medicine in breast cancer.
Just a few months ago, following a routine mammogram, Susan Patterson got a call from her women's health team.
And they kind of gave me the choice, do you want to look at this further or do you want to just wait and do your mammogram next year?
Susan opted for further testing. Her results came back a few days later.
My husband was standing beside me, so he saw the phone fall to the floor.
Sure enough, those tests confirmed Susan had a kind of breast cancer found in about 1 in every 3 women diagnosed. That's according to Dr. Jessica Wobb of Fort Hamilton Hospital. It is called DCIS.
It's called ductal carcinoma in situ, and it is actually stage 0 breast cancer. So there is actually a stage 0. And it is when the cells, tumor cells have not yet broken free from the ductal work of the breast.
But when Susan had surgery to remove the area that contained the cancer, she was also given the option of allowing her tumor cells to be sent off for the results of a breakthrough test known as DecisionRT. The RT stands for radiation therapy.
It gives us a number. That number shows us the percentage of likelihood that this tumor would come back within the first 10 years.
Dr. Hillary Shapiro-Wright and Dr. Jessica Wobb are among the first in the country to offer women this test.
And it's a good 10-year data, so you can tell someone that in 10 years, the likelihood of you having a recurrence in the breast would be, this much with just the surgery you had, and it would be this much if we added radiation into it.
When Susan got the results from her DecisionRT, she told me,
with no treatment at all was 15% recurrence, and the testing showed that with the radiation, 7.5%. It cut it in half.
Susan Patterson made the decision to have the radiation. Her team points out, while similar tests have been available for chemotherapy or hormone treatment,
there's never been a radiation-related test to answer questions like that.
As for how Susan is feeling now, she says she is grateful for the ability to make the best decision for her own body and her future good health.
I feel that God puts us where He wants us to be, and I felt that's where I needed to be.
At Fort Hamilton Hospital in Hamilton, Liz Bonus, Local 12 News.
Right now, the test is used in stage 0 breast cancer, but similar tests for other stages of the cancer are also in the works.